Welcome to the second part of this episode of Beyond Health with our guest, Dr. Mouzayan Ginzarly. In case you missed the first part of the discussion, you can find it by clicking the link in the top right corner. The different discussion points are all timestamped throughout the episode, so you can freely move around as you see fit. So you mentioned the AVIV protocols a few times. Can you take us through the specific protocols? I know that the reverse aging is the area that you're most famous for, but maybe you can let us know what differentiates AVIV's protocols overall from other clinics internationally and regionally.
So at the AVIV clinics, we have developed a comprehensive protocol aimed at enhancing the body's regenerative processes and reducing the impact of aging, mostly. The AVIV medical program combines a range of cutting-edge technologies, including hyperbaric oxygen therapy, of course. We have multi-place chambers. We combine nutrition with a specialized nutritionist, dietitian, cognitive training, as I said, using really scientific tests, and physical exercise to optimize brain and body health. The cognitive training exercises challenge the brain and stimulate the growth of new neural connections, which can improve cognitive function and overall brain health. Hyperbaric oxygen therapy has also been shown to enhance neuroplasticity, as I mentioned earlier, by increasing blood flow and oxygen delivery to the brain, which can promote the growth of new blood vessels and the development of new neural connections. So what we actually do is when the clients are in the suite, they have a tablet in front of them where they have a cognitive training tailored to their needs. So while they're exposed to the oxygen in the chamber, they are actually training their brain. And we believe that the more you train your brain while you're exposed to this oxygen, it will enhance better the recovery or the improvement of these specific areas that you're activating in the suite, the hyperbaric oxygen chamber. So they do on daily basis have this cognitive training, which is monitored by our expert and which we change and adapt on weekly basis. And we can see the improvement actually of the clients. Is very interesting because we can actually monitor their improvements on weekly basis and see how they are improving. We have different protocols as well that are adapted to the indication. So not all our clients will have 60 sessions. Some of them will have only 40. Others will have only 10 according to the indication. But we treat mostly chronic medical conditions. And we promote mostly the reverse aging because our slogan is brain performance for life. So our aim is to create, or we imagine actually, an Alzheimer-free world. And we always spread awareness about the importance of prevention. We don't need to wait until we have symptoms or we feel the decline or we're not feeling good to do the treatment. We should actually do it even before it starts to prevent these symptoms from starting. And this is the main goal and aim of the AVIV program and protocol. And this is what we're trying to spread worldwide. So up to now, we have 3 clinics in 3 different countries. A 4th one is going to be opening soon. And hopefully in the 10 coming years, we'll have more and more clinics opening to spread the awareness and the good that hyperbaric oxygen therapy can do and the change that can make in medicine.
The thing that I find the most interesting in all of this is the holistic approach of obviously using both physical and neurological stimuli to improve function. But I'm curious, especially when it comes to, for example, the brain training games that you're talking about, are these really that effective? And is there a direct synergy with this and HBOT that catalyzes it? Or is it just a matter of giving the clients something to do, something active to do, to keep them stimulated during the procedure? Any studies done on this, maybe?
Actually, the research that we've done has always been within the AVIV protocol. So we always compared 2 groups of people who are not having the hyperbaric oxygen therapy and the people who are the other group that is having the hyperbaric oxygen therapy with the training. So the whole protocol. So the whole protocol is evidence-based. In a simple way, the neurons in our brain are like, our brain is like muscles. When you go to the gym and you train all the time, your muscles will get bigger, they will get stronger, and you will be able to lift heavier weights every time you go. If you're consistent, you're going on a regular basis. And the brain is the same. The more you activate your neurons and the more you use them, the more you challenge them, the better performance they will have. So this is what we're trying to do during the 3 months. We're trying to challenge your brain and your cognitive functions, and in a consistent way. It has to be on daily basis to get the best of the results at the end. So we do it in the suite, and it's not for a long time. Like they do 20 to 30 minutes in general. If they want, they can do more. And then we monitor this. And then they have cognitive training after the suite. Because after the chamber, they have follow-ups, right? Within the protocol, the program. So they have different kind of follow-ups. It could be physiology, physiotherapy, with a dietitian, or with the neurocognitive team and with experts. And these follow-ups are a little bit different. The training is a little bit different. We do a lot of trainings on multitasking, for example. We have very advanced material and machines for this. So we combine the physical and the cognitive together. So you're going to be walking or jogging, but you're going to be challenged to do some games on the same time while walking or jogging. All this will enhance actually the cognitive function at the end of the treatment. This is from training point of view to enhance, but the core of it is related to the hyperbaric oxygen therapy itself, following the two processes and the pathways that I already explained earlier, the neuroplasticity and the angiogenesis. Because with the new stem cells and enhancing the neuroplasticity and increasing the oxygenation of your different cells in the brain will enhance the performance as well in different areas, mostly the areas that you're training on regular basis.
So is this a generalized training protocol or is it tailored?
No, it's tailored. It's very tailored and personalized, of course. So if I have, for example, problems in attention, but my memory is excellent, we'll be focusing more on the attention. In your case, if it's vice versa, for example, it's the information processing speed, we'll be focusing more on this. According to everyone's needs and decline in specific areas, the protocol will be very tailored to every single client/patient.
Interesting. So you mentioned the study. I'm curious, was the control group undergoing any part of the protocols without the HBOT, or they were just the control group that were not doing anything?
You're going to be surprised to know that this kind of research is very complicated to develop, actually. And I was quite surprised to see the amount of research that they were able to do, actually, under these circumstances. To get significant results in medicine, like evidence-based results, both groups shouldn't know what they're having or not having.
So it's a double-blind study?
Exactly, because we have to eliminate bias. So both the groups, they don't know if they're having the real treatment or not. So the other group will be placed in the chamber with the same sounds and with them for 3 months on daily basis, but they won't be getting any oxygen or not exposed to the right pressure.
Interesting.
So
but they're undergoing the same training and physical tasks as well?
Yeah. Both groups have to undergo the same feelings, the same things. For example, the second group will be given a placebo, a tablet, but it's a placebo. So they don't know what they're getting because psychologically it can affect the results, knowing that you got the treatment or not. So even the doctors, they don't know which group they're following during the 3 months. So no one knows what's going on. But we're ethical at the end of the day. So the group will then get the results. If the results are significant, they get the oxygen therapy to improve them later on.
That's very interesting. And I'm presuming then there's a statistical significance between the two groups?
Yep.
Great. I'll make sure to keep a link to this study in the show notes then. I presume this was the case for the treatment side of things, but is it the same for the preventative and anti-aging protocols?
There's a very interesting paper as well. They did a double-blinded clinical trial on healthy aging. So they were really healthy people, not sick. And this was to show how hyperbaric oxygen therapy could reverse aging. And if we want to talk about the prevention part. So there is a study out there. People were not sick. And they underwent the hyperbaric oxygen therapy for 3 months as well, 2 groups.
Interesting.
This is where the brain performance for life comes from. And this is why this clinical based on this research, actually, they recruited people who are very healthy and they are more than 55 years old, of course, and the cognitive function, everything was normal. They never complained of anything. And actually, they did this research to compare the performance, the cognitive performance, the physical performance at the end of the treatment. And of course, we see that the cognitive performance improved, the mood improved, the sleep pattern improved. And the most important thing that we see as well, when we say reverse aging, what does this mean actually? It's very important to understand because sometimes, how am I going to look like I'm 10 years old or 15 years old? No. How many years are you taking me back in time? Am I going to be 20 again? Actually, when we say reverse aging, it's mostly reversing the biological, the cellular age. How do we measure this? We measure this by measuring the length of the telomeres. So telomeres are the cap that we have on our chromosomes extremities. Chromosomes is our DNA. And this protection of our chromosomes are called telomeres. The length will shorten when we age at a point that it's too short that the cell itself cannot replicate anymore. So it can't really do any beneficial role in our body. So with the treatment, we could actually demonstrate that the length of these telomeres increases after the 3 months of hyperbaric oxygen therapy. So we could reverse the biological aging and the cellular aging in our body. And this will give a better chance for our cells to be healthier, to replicate, to be energetic. And at the same time, it prevents chronic diseases in the future, dementia, and other medical conditions that could be related to the aging process.
Is there a relation between the impact of HBOT on the mitochondria as well? Because all the improvements you mentioned sound like the things that the mitochondria is responsible for and the role it has.
Everything is about the mitochondria in our body.
And they're the power cells of the brain and the whole body.
Right? Yeah. Because this is the engine of our cells, right?
Exactly.
Without mitochondria, we cannot, nothing can really work properly. So when we increase the oxygen in the cells, actually it increases as well in the mitochondria. So you're giving more energy to the mitochondria, which will make it even more active and the performance will increase. And this is very important because this reflects on the performance of our cognition, the physical, the mood, and everything in our body. So this is the main component of the cell actually that's promoting all the improvement as well, the mitochondria. And there is a lot of research on this, very interesting as well, because they've been looking at the mitochondria and its behavior after hyperbaric oxygen therapy under the microscope. And they do this biological and cellular research. And then actually they show how they could show actually how the mitochondria can even replicate. We can have duplicate of the mitochondria because of the effects and the impact of the hyperbaric oxygen therapy.
That's very interesting. And I'm sure this plays a role in the anti-aging process too. You mentioned the standardized tests that you do before and after each procedure. Firstly, I wanted to ask, are these standardized across the AVIV clinic or are they an industry standard across different clinics? And can you give us a bit of insight on essentially how effective success is actually quantified within these protocols?
Actually, I don't know if we're really quantifying here, but yeah, you have objective measurements to see how you improved significantly on different levels, as mentioned earlier. For example, I'm going to give just an example other than the neurocognitive assessment and the physical assessment. We have, for example, I said the dietitian. So we have the SICA that everyone knows that we can quantify a little bit the fat mass, the skeletal mass, the water. So this we do on monthly basis, to give an example, and we extract the numbers and we see how the patients/clients are improving. If regarding the cognitive assessment, evaluation, and training, what we use is standardized scientific tests that are actually standardized within the neurocognitive general assessments worldwide. It's not specific to AVIV. So these are the tests that are generally used in this specific field to assess patients and to cognitively train patients. So we got the best out of these standardized tests, and these are the tests that we are using. We use for the training Brain HQ that actually you can upload on your phone and do it 20 minutes every day. It's enough. Very nice. You can use for children as well. Brain HQ is very well known. We have CogniFit, constant therapy, different therapies according to the profile of the client's patients and on the cognitive decline, how important it is, because we need to adapt the test as well. It has to be tailored to the patient's and the client's needs.
Yeah.
Then for the evaluation, we use different tests, battery of tests, and they are standardized as well, but they are different because we believe, and it's known that when you repeat a test, you have some bias related to this because repeating it will make you more comfortable doing it. So you might get all the right answers because you repeated it several times. So for assessments, we use different tests. We use the test only once before and once after. So the results would be more accurate. And for the training, there are completely different steps.
So it's the same set of questions both times?
Same sorts of questions, yeah.
Because I was expecting something like a randomized IQ test, for example, or is this different for reverse aging?
No, but these are difficult tests as well, and they have similarities with the IQ. But the IQ is not used usually in dementia and early Alzheimer's and a lot in adults who don't have specific complaints. So we have different indications. Sometimes we indicate the IQ test, but in different population. But this won't be to compare the before and after. It's not one of our standardized tests that we use so far, because the one that we have are more suitable, let's say. These are the most used ones in the cognitive evaluation that we do at AVIV, the specific cognitive evaluation that we do at the clinic. Because there are a lot of tests, like hundreds, thousands outside. So we selected the most used, most accurate, and the best test that suit our protocol as well.
What about physical benchmarks? You mentioned the Sika scan. I would have preferred DEXA, but Sika will do, I guess. What about other physical parameters? Do you, for example, measure strength or endurance?
So we have two parts here, the physiology and the physical therapy. And the physiology part, we have a very specific test that we are doing. It's the CPET, so cardiopulmonary exercise test, where our patients/clients, they do cycling or they walk on a treadmill, and they have a recording actually and monitoring of the ventilation, how they breathe, and their heart activity. And this is an incredible test. It's the equivalent of a stress test, but on top of that, they have a mask for the ventilation. So it provides us with a lot of information, actually, including, I'm going to go into the technical here. Like, for example, we measure VO2 max, VO2 at anaerobic thresholds, VCO2 slope, and a lot of measurements like this, which in a simple way will reflect actually the capacity of your body to comply with high intensity exercise. And by getting all this information, it will allow us to know if your heart can comply with high intensity exercise or not. Is it too slow? Is it too fast? The recovery timing, does it recover fast or slow? And the efficiency of your breathing, is it efficient, not efficient? And with these different results, we'll able actually to identify the physical problems that you really have and in order to work on it during this 3 months and improve it. And the hyperbaric oxygen therapy, of course, will improve it as well, plus the training that you get during the protocol, actually. So you can continue training your heart, your ventilation, and increasing your muscle mass even after you finish the treatment. From a physical therapy part, we have all the evaluation that you mentioned earlier. So we have the strength, the muscles power, your balance, your pressure when you walk and all this. And we have a very specific, up-to-date, amazing machine here. It's called the Cosmos. It has thousands of sensors that can actually sense your posture, your balance while walking, while standing. And this is amazing because training on this will improve your balance, your posture, your gait at the end of the treatment. And this allows us actually objectively to see if you have any problems and how you improved later on, because you get images, you get numbers, you get graphs. It's quite interesting, objective, and you can see if it's significant or not. So I think this responds best to how to quantify, if we can call it quantifying, but this is what we're doing at AVIV within the AVIV protocol so far.
And what about strength parameters? You mentioned the cardiovascular and some of the postural and other factors. Is strength also measured in any way?
the dynamometer. So we have a specific material, machine, protocol for every measurement that we do. The best will be for you to come and try. So you
Yeah,
can
let's
go
see.
through the experience yourself and see actually
Yeah,
what I've
maybe.
been doing. It would be interesting to share some photos because I have a lot of photos to actually see what we are using. We even have a pain assessment machine. The pain assessment is very interesting as well in fibromyalgia or chronic pain that we use it as well sometimes to assess a little bit the sensation and the perception of pain in our clients, patients. So every assessment will be really based on standardized tests.
You mentioned nutrition and training a couple of times, so I want to step away from the quantification and touch on the fat loss aspects a bit. When the word oxygen is mentioned, where my mind goes, just because of my personal interests and my areas of focus, is its relationship to fitness and fat loss. So oxygen obviously helps us fuel through endurance training, but it also plays a key role in fat oxidation. And in fact, as I'm sure you know, when we burn fat, the great majority of it is excreted as carbon dioxide in breath. So this brings me to my question. What is the relationship between HBOT and fat loss or other body composition related effects like muscle gain? I know that there was a recent study looking into the impacts of HBOT on rats, but to your knowledge, has there been any studies on humans? And how have you seen your patients and clients improving or changing their body composition over the duration of these protocols?
To my knowledge, there are currently no studies really investigating the direct relationship between HBOT and fat loss in humans. Based on our experience, treating the individual with HBOT at AVIV clinics for the last 20 years, we know that the body's metabolism increases during the treatment due to various regeneration processes that we mentioned earlier. However, we cannot directly attribute weight loss to HBOT alone. Instead, we have observed that most clients and patients who follow a personalized diet plan and physical training regimen during their HBOT treatment tend to lose weight while improving their muscle mass, which is part of our pre and post treatment assessment routine testing. To be honest with you, I've gone through the treatment and I would feel extremely hungry when I get out of the sweet chamber, which is normal because the whole metabolism is increasing. So what we try to do is you're gonna be feeling hungry, but if you can control it by eating healthy and training right after it, you lose weight for sure. And you will gain more muscle mass and you will reduce your fat mass. But if you get out of the chamber and you don't want to do any change in your lifestyle and you're still eating and you're even more hungry and eating more, this will not lead actually to losing weight. But the fat mass part, yeah, actually it helps reduce the fat mass. But to see it and to lose the weight, you need to do efforts. It's an individual effort, commitment, and individuals have to follow a specific diet and they have to maintain a physical activity regularly in order to see the results on their weights.
So you've just described every type of diet basically known to man. I think a real factor is always consistency. What I've always seen in dietary interventions or basically when someone goes on a diet, it could be any kind of diet really. As long as caloric intake is monitored consistently, they'll see results, whatever that might be. I am curious to see if there's studies that measure metabolism rather than fat loss in HBOT, because obviously, like you said yourself, if your metabolism increases, but then you're actually increasing your intake of calories, then that's not going to make any difference for you. So are there any studies to your knowledge that have been done on this, on humans or otherwise?
Not on humans. Yeah.
Yeah. And ongoing studies? Anything coming up?
Yeah, but some studies are there, they're going on, but we're still at the stage before humans. But it's very promising. It's quite promising, but still, there won't be a magical treatment where you actually do it and then you eat whatever you want and you don't move and I'm gonna lose weight. There will always be this personal commitment actually to wanting to lose fat and weight. And every treatment will be combined with your and personal will and commitment actually to get there. Yeah.
That's very interesting. And I think these studies could definitely shed light on some other areas too. I mean, speaking of metabolism, I've heard many people calling Alzheimer's type 3 diabetes these days in research settings, not medical specific settings, because of the potential connections of insulin resistance in the brain and Alzheimer's. So, seeing as HBOT can help halt or reverse cognitive decline, I'd be very curious to see how these things might correlate other than the studies that are out there. But until the research is done, let's touch on more tangible things. Athletic performance is another area where some work has been done on HBOT, as far as I know. You mentioned cardiovascular tests and some strength training elements in the reverse aging protocols. What about athletes who want to improve their performance? For example, football players, professional athletes of any kind, if they wanted to undertake HBOT, would this be something that could essentially help them improve their performances in a productive way?
So based on our experience at AVIV clinics, we have found that HBOT can potentially improve athletic performance by reducing inflammation, accelerating recovery time, and enhancing oxygen delivery to the muscles, and mostly the mitochondria that we were talking about earlier. So at AVIV, we have different protocols for the athletes. We do enhanced performance, physical and cognitive. Gonna be telling me cognitive and athletes, yeah. Because for example, when you play golf or polo, cognition is very important and they have to be multitasking. So they have a
Of
specific
course.
protocol. We have a specific protocol for rehabilitation after injury. We have a specific protocol for recovery and recovery from long COVID syndrome. If they have the long COVID syndrome, and long COVID syndrome means that you still have symptoms after 3 months of having the COVID, the acute infection, actually. And this is not only for the athletes, it's for everyone, actually,
Of
and
course.
mostly the athletes, if it's having any impact on their performance.
Interesting. So we can improve lung function, I'm guessing, based on that,
Yes.
and muscular function too?
Yeah. And this we will measure mostly, remember, by the CPAT, the cardiopulmonary ice test, which is an amazing test. We can see the improvement of the test and they even feel it. And it's incredible results for the long COVID syndrome.
That's very interesting. I have no trouble imagining why VO2 max would increase after HBOT, but I am curious how long after the protocols you go back and test them again to see if it's lasted basically the effects. Does it last long term, 6 months, a year after the protocols, or is it just short term benefit?
In athletes or generally?
Either and or.
Usually, if it's the VO2 max and other measurements were declined or decreased because of a medical condition, for example, long COVID or other injury, of course, when you reverse it or it improved, it improved. It will not decline again unless you have the injury or the medical condition again. But if we're talking in healthy individuals, as long as you're training physically enough, this will be maintained. It will be affected mostly by the aging process because we know that when we age, automatically and naturally, our performance, physical performance and cognitive will decline a little bit with time. Even if we do everything that we can to prevent it, it will decline a little bit. What we do usually in AVIV protocol is we continue monitoring our patients/clients. It's not that at the end of the 3 months, we assessed you, you're better, bye-bye, see you in 10 years. No, we do monitor them. So they come systematically after 6 months and we evaluate again. Most of the functions we evaluate, even if they don't have any complaints. We offer to evaluate again. And then it's up to them to come on a yearly basis and evaluate as much as they want. So we can actually detect in advance if there is any decline in physical or cognitive. And we have what we call as well a maintenance protocol. So for some clients, patients, if they want to continue to maintain the longer time possible, they can still come once or twice a week after they finish the 3 months of treatment. And this will help them.
Okay. And is that the range you would need once or twice a week, or could it be, say, once a month? Is there any best practice for the maintenance protocol?
Regularity is very important.
Right.
Once a month, once or twice a week, because after the oxygen, you will have a training to do, cognitive or physical. So it will help you implement as well a certain routine and consistency. It's very important. In some cases, it's indicated. We suggest that they should continue because they show amazing improvement at the end. And we feel like they need a little bit more push and they will improve even more. For some people, it's not always indicated. It's optional. For example, for the reversing aging, if they have amazing results at the end, it's up to them if they want to maintain or they prefer to stop for a while and then come back later and check again. So it's going to really vary and depend on the medical condition, on the individual, on the expectations, on the outcomes, and our goal, short-term and long-term goals as well.
That's fair enough. You mentioned stem cell production from HBOT. I'm curious, is there any synergies between HBOT and other types of treatment like stem cell therapy, for example?
So with the hyperbaric oxygen therapy, you're regenerating your own stem cells. It's your own body regenerating an unlimited number of stem cells that's going to be migrating everywhere and differentiating into different fixed cells and organs in the whole body. Whatever needs to be, let's say, fixed, enhanced, it will happen. It could be the skin, it could be the neurons or any other organs. Stem cells therapy is different. Like you're getting stem cells, but you don't know where you're getting it from. It's not yours. And they're not injecting it right away. We don't know how the conservation was done. We don't know if they're still very active and very beneficial as the ones that you're regenerating or not. We don't know what will happen during this time that we took it from, I don't know, it could be an animal source. So this is what they're using, deers or others. And then they inject it in your body and it's local. They inject it, for example, under a certain area of the skin and a joint. So they have local effects. And in some indications, it's working, it works, and it has benefits. Of course, there is absolutely no conflict about this. But HBOT and stem cells, they're completely different. And the indications are different, and the source is different, and the application is different. These are completely two different treatments. But if you have to choose between those two for an optimal results, of course, it will be the hyperbaric oxygen therapy because you're getting more stem cells, it's yours, and it's fixing everything.
What about using them complementarily, though, in conjunction with one another? Any examples of protocols for this?
No, you don't need to, actually. HBOT will be more than enough. You don't need to add on ozone therapy. You don't need to add on stem cells injections. It's going to do the whole job.
Fair enough. It takes care of the whole shebang, if you will. And what about synergies with psychology and mental health treatment? You mentioned PTSD and anxiety a couple of times earlier. Anything along those lines?
Oh, yeah. Interesting question. Actually, HBOT has been studied as a potential treatment for addiction and other mental health problems, disorders, but the evidence is very limited and mixed. Some studies have suggested that HBOT may have anti-inflammatory effects and improve brain function, which could potentially have benefits for individuals with mental health disorders, such as depression, anxiety, and post-traumatic stress disorder, the PTSD. Individuals usually describe a better mood and reduced anxiety and impulsiveness after the dedicated protocol at AVIV. AVIV clinics have been treating PTSD by adopting a specific HBOT protocol, and we have been witnessing great results in this specific indication, PTSD. And we have research, studies, and we really have amazing results. However, HBOT is not usually used as a standalone treatment in these cases and should be used in conjunction with other evidence-based treatments such as psychotherapy and medication when it's indicated. So we don't really use it alone. And we have amazing results, but it has to be in conjunction with other therapies that are indicated according to each indication.
So, for example, for the PTSD protocols, I'm sure it would be very tailored. But can you give us an idea of what this entails, generally, the process maybe, and what results you've seen specifically?
You remember the repressed memories I told you about?
Yeah, exactly.
So it's a little bit unpredictable. This is what's really challenging. We don't know how these repressed memories will come back and how the patients usually will react to it, right? So we have to be ready and experienced and know how to deal with these situations. This is why we have a team of experts here, and we don't wait for the difficult times to happen. We prepare the patients in advance. So we explain to them what might happen and what they're going to be facing during the treatment. And they're prepared and they're committed and they want to heal. And as experts, we are here to support the patients. And on the same time, the follow-ups and the trainings that I talked about earlier, it's very tailored. So in this case, of course, they're going to be having neuropsych and psychotherapy support. And this is going to be, sometimes it's even on daily basis. So we are there, we're checking on them, and we're supporting them through the treatment. In general, these patients have already medications. It's very rare to see a PTSD patient without any medication or psychotherapy or have gone through psychotherapy for a long time. So we continue the medication, we continue whatever is needed for a while until we feel or we see that we have positive effects and that the patient is getting better. And then we start reducing slowly until the ultimate goal is to be medication free. This will be our ultimate goal with the patient. But yes, in this specific indication, we have enough research and science to be confident actually that HBOT really have significant results and improvements in PTSD patients. Regarding the other indications like anxiety and depression, we know that it doesn't get worse and it improves during the treatment, but this as well, it's not scientifically proved yet. Like we didn't have two groups of depressed, not depressed, and let's see. It's mostly based on the experience that we have during the 20 last years from our patients, from our clients. We see that their mood improves, they're happier, they're less impulsive, the sleep is better. So this is mostly based on our experience with our clients.
Interesting. It's really interesting. There's a lot of studies on both those directions and different bodies of research. So I'm very curious to see how these things turn out.
Yep.
PTSD is one that you really got me thinking about because there's some recent studies on the impacts of psychedelics on PTSD and how they can essentially help disassociate the emotional connection to the trauma. You can essentially live through that trauma without going through the painful memories and experiences and emotions. So I'm very curious to see how this research moves forward with all these different types of conditions and find solutions to problems that have been really ailing people for a very long time. Not to get too far off topic though. So on the subject of upcoming research, we talked about the fat loss, potentially some new research coming on humans. But is there any other bodies of research to your knowledge that are coming up that are of special importance or just interest to you specifically?
As you've been mentioning, like you're expecting and you're so motivated and excited about seeing some research happening, combining this therapy with HBOT. I think there are a lot of people, including me, that are very excited to see the research, evolving research in this field. So the field of HBOT is constantly evolving. So many studies have been published in the last 10 years in different areas of research, including traumatic brain injury, stroke, and eventually cancer. And this will be the most exciting one as well if we get more research in the field of cancer, specific types of cancer as well. Other interesting, very promising areas of research are dementia. We're starting to have research about dementia, early Alzheimer's staging. We have one research that came out that was really amazing, but still not really on humans yet. Fibromyalgia is a field that I'm personally interested in a lot, and PTSD. But I'm sure there will be hundreds of other areas that's going to be evolving in the upcoming years in the field of hyperbaric oxygen therapy, because it's starting to be very well known. People are starting to be aware of it, knowing more about it. And research has been easier as well, like to be applied and done in this field specifically.
We'll be looking out for those for sure. Anything else you want to add? Anything else our listeners should be looking out for in the coming years on this subject?
I think I'm going to be a little bit repetitive here because we've said a lot of things already. I would conclude with hyperbaric oxygen therapy. It has been found to have benefits beyond just treating and preventing a number of medical conditions. An interesting study was conducted, as I mentioned earlier, on the effect of hyperbaric oxygen therapy on the aging process in a healthy individual. And I really invite all of you to read this paper because it's extremely interesting. And it's really rare to have treatment or a paper on healthy people. We usually test sick people, but no, this time it's healthy people and what we can do actually to be even healthier. And this demonstrated that it has the ability to reverse aging, as I explained earlier. And this is what we are imagining actually in Alzheimer-free society. AVIV clinics have implemented the AVIV HBOT protocol, which involves 60 sessions, 2 hours of HBOT sessions, 5 days a week. This protocol has been shown to enhance physical and cognitive performance and reverse biological aging. We consider, and I do consider, that this protocol is really unique and includes a comprehensive evaluation before and after treatments, allowing clients to witness and receive scientific evidence of their significant improvement, which is very important and which I didn't see happening in any of the other clinics so far. However, it's important to note that not all HBOT chambers are safe and efficient. To ensure a safe and effective treatment, it's important to seek out certified clinics that comply with local health authority regulations and are monitored by highly experienced medical staff to prevent any dangerous incidents.
I love that you said that. I think, of course, it's very important anytime you're talking about anything medical related to always consult your physician before you undertake any procedure, and to always make sure, obviously, any facilities that you're going to are certified in the local authorities, that whatever is required of it. So I think that's a perfect note to end on. Thank you so much for your time, Dr. Mouzayan. It was an absolute pleasure, and I really enjoyed our conversation.
Perfect. Thank you.
And with all the bodies of research, maybe we come back in a couple of years or even sooner and see what's changed.
Yeah. With the new updates. Yeah, for sure.
Thank you. Thank you so much. I appreciate it.
Thank you.